Disease related to heart and circulatory system. Some of the common disease which are related to heart and circulatory system are: first, high blood pressure. High blood pressure is also known as hypertension. Hypertension is the term for blood pressure that is higher than the normal. Normally the blood pressure is 120 by 80. It means in this measurement 120 mmHg is the systolic or pumping pressure and 80 mmHg is the diastolic pressure. If repeated checks of this blood pressure of an individual reaches to 140 by 90 or more, it shows hypertension. High blood pressure leads to heart disease and also affect the vital organs like brain and kidney. Persons suffering from high blood pressure should avoid emotional disturbances and excitement. Second disease is coronary artery disease, which is also known as CAD. CAD is the most common type of heart disease. It is also called coronary heart disease or CAD. In this disease, vessels that supplies the blood to heart muscles are affected. It is caused due to deposit of calcium, fat, cholesterol, fibrous tissue, etc., which makes the lumen of the arteries very narrow. At this place all these things get deposited, and because of this the vessel which is supplying the blood to the heart muscle, that is coronary artery, get blocked. Third disease is angina. It is also known as angina pectoris. In this disease, the main symptom is acute chest pain when not enough oxygen reaches to heart muscles. It can occur in any age of any man and woman, but generally it is common in middle-aged and elder person. It occurs due to the condition that affects the blood flow. The next disease is heart failure. Heart failure is also known as congestive heart failure. Heart failure means it is the state of heart when the heart is not pumping blood effectively to meet the need of the body. Heart failure is not the same as cardiac arrest when the heart stops beating, or heart attack when the heart muscle is suddenly damaged by an inadequate blood supply. The next disease is myocardial infarction. This is actually heart attack. In this disease, it is a very serious, often fatal consequences, means very harmful and damage the body. It often results from sudden decrease in coronary blood supply. Coronary is the artery which supplies the blood to the heart. The portion of cardiac muscle without oxygen supply dies within few minutes and is then referred as myocardial infarction or heart attack. The next disease is valvular disease. As the name suggests, it is characterized by the defect in any one of the four heart valves. Four heart valve means they can be mitral, aortic or tricuspid or pulmonary. Because of the defect in these four valves, there is mixing of oxygenated and deoxygenated blood. So this disease is known as valvular disease. Next is coronary thrombosis. Thrombus, that means blockage, and coronary means related to heart. So as per the name suggests, in this disease, a blockage of the flow of blood to the heart is caused by a blood clot in the coronary artery. The next disease is heart block. Heart block is an abnormal heart rhythm where the heartbeat becomes too slow. It is not capable of sending the electrical signals to ventricle and lead to improper movement of ventricle, and because of this the circulation stops. The next disease related to heart is rheumatic heart disease. This disease is caused due to infection in Streptococcus viridis. It is a bacteria. In this disease, the valve do not function properly. This bacteria attack the valves of heart and makes them weak, because of which the heart muscles doesn't work properly. The next disease is ventricular fibrillation. In this disease, when the heart queer instead of pumping due to disorganized electrical activity. Or in other words, we can say that every part of ventricle works differently. All the part of ventricle works differently. There is no synchronization in between them. Then this disease is known as ventricular